Helicopters provide a fast, versatile response to emergencies and can be the most effective way of getting highly trained clinicians to an incident. They can also be the fastest way to transfer a critically ill patient from our hospitals to a specialist treatment centre. This DVD will explain the use of the helicopter landing facilities at Margate, QEQM and the William Harvey hospitals. It will explain the rules and demonstrate the process of carrying out the helicopter landing and takeoff. It is important that you are aware of the safety procedures that must be followed when on or around the landing sites. At both the QEQM and William Harvey hospitals, purpose-built 24/7 helipads are available at the front of the building, adjacent to the emergency department. These pads can be used for any helicopter traffic at the discretion of the pilot. However, the Trust does not accept routine military training flights. The hospitals are mostly served by the Kent, Surrey and Sussex Air Ambulance Trust, who fly 24 hours a day to incidents across our area, providing expert pre-hospital care at the scenes of serious incidents. The Trust is also served by search and rescue aircraft from HM Coast Guard, who have winching capabilities and capacity to transport multiple casualties. Occasionally, you may see other aircraft, such as helicopters from the police and Children's Air Ambulance Service. Irrespective of the size or type of aircraft, the main priority is the safety of patients, visitors and staff. The aircraft provider will notify the appropriate emergency department of an inbound helicopter, irrespective of whether it is carrying a patient. The emergency department must immediately report the incoming aircraft to the switchboard on 2222, clearly stating which site they're calling from. Switchboard will then alert the helicopter team via the bleep system, including porters, security, estates and clinical site managers. A rapid check of the landing site will be necessary before the aircraft lands to ensure it's free from obstructions, foreign object debris such as litter, and to ensure no one is standing in the landing zone. Special care needs to be taken with pushchairs, pets and small children. Car parking will also secure perimeter roads and footpaths. Remember, you will not necessarily know what sort of helicopter is coming in or from what direction, so you must follow the instructions given by security and the clinical site managers. If a patient is coming in, then a trolley from the emergency department should be prepared. This trolley should have no equipment or linen on it, and those preparing to receive the patient should wear gloves. The trolley must not be taken onto the landing site until the aircraft has landed. Once the aircraft has landed, the team should wait until the rotors have been turned off and engines have been shut down before approaching the landing area. If the air crew are not available, then thumbs up signal from the pilot must be obtained before approaching the aircraft. It is important the aircrew take the lead in removing the patient from the aircraft, as they are trained to use the equipment. Clinical handover should take place in the emergency department and not on the landing site. Everyone involved in helicopter reception must wear high visibility clothing. Those outside during landing and takeoff should consider wearing eye and ear protection. For larger aircraft landing, such as HM Coast Guard, eye and ear protection is mandatory. A cabinet containing personal protective clothing is located in the emergency department entrance lobby at William Harvey, and at the QEQM it is adjacent to the Incident Control Centre. If staff are required to go onto the landing site when the aircraft's rotors are running, then full PPE should be worn as per hospital policy. All precautions taken during landing must also be followed during takeoff. Remember, the helicopter may take off in a different direction than it landed. It is essential that the helipad lights are switched on as soon as a landing alert is received. They must then remain on until the aircraft has taken off. It is important the lights are not switched off until the aircraft has departed and can no longer be heard. This will allow the pilot to return in the event of difficulties. It's important that no flash photography, laser pens or torches are shone at the aircraft, as this can distract the pilot. In bad weather, you should take extra care, as paths may become slippery. In the event of a fire or accident on the landing site, staff should withdraw and call for the emergency services via 999. Where clinicians are considering transfer out by air, they should discuss this with the clinical site managers, who will manage the arrangements for landing and transfer team welfare. Initially, transferring clinicians should discuss the case with the HEMS support desk at ambulance control. Where HEMS are unable to transfer, the clinical site managers have contact details of other providers, such as HM Coast Guard. The ability to transfer by air depends on numerous factors, not only the weather conditions en route, but fuel and landing facilities at the destination, along with the patient's condition. All air transfers must be authorised by a consultant. Never stand in front of the aircraft approach. This may lead to an aborted landing. Never approach the aircraft from the rear. Never approach the aircraft with rotors on unless you're wearing full PPE, including a helmet, eye and ear protection, and you have a clear thumbs-up signal from the pilot or are escorted by the aircrew. If the doors are not open, even with rotors off, you must await a thumbs-up from the aircrew before entering the landing area. High visibility clothing must be worn at all times. When large helicopters are inbound, eye and ear protection is mandatory.